Joining us now is neurologist Dr. Leah Kroll. Doctor, so many questions for you this morning. You know, Tylenol has been billed as the safe option for pain relief, fever reduction during pregnancy. How was that conclusion reached?
Listen, Kelly, let me start by getting crystal clear here. There is no credible scientific evidence that demonstrates a cause and effect relationship between Tylenol use in pregnancy and autism. Okay, period. It's just not there. This announcement was really based on a cherry picking of interpretations from some studies, but the best scientific evidence available that we have on this does not demonstrate any cause and effect relationship there. And that is why the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics still say Tylenol is safe if you need it for fever or pain.
Right, and there is this question looming about what has, caused this uptick in autism diagnoses. But first I want to ask you, to your point, the president seemed to hint at the top of the press conference that there's a chance this most recent guidance may be inaccurate, saying to start, it's not 100% understood or known, but I think we've made a lot of strides. Then he said this.
The way I look at it, don't take it. Don't take it. There's no downside in not taking it.
So the parent company of Tylenol, Kenvue, reportedly stating this: without it, women face dangerous choices, suffer through conditions like fever that are potentially harmful for both mother and baby, or use riskier alternatives. We know fevers can be dangerous during pregnancy. This guidance coming from the press conference, if it is inaccurate, what are the implications as you see them?
Major implications here. Like we said, no definite link in terms of cause and effect between Tylenol use in pregnancy and autism, but there is a definite link in terms of cause and effect between untreated fevers in pregnancy and bad outcomes for both mother and baby, particularly pertaining to the development of the baby's brain and nervous system. Another thing we know for sure that has been demonstrated time and again in the scientific evidence is that other non-Tylenol pain medications like aspirin or ibuprofen can definitely be harmful for the baby when taken during pregnancy. So there's a lot of cause for alarm and concern here that this advice could result in harm to patients, babies, mothers, to say nothing of the fact that it's becoming increasingly difficult to really separate fact from fear here. And the best we can do is just cling to what we know in terms of the best available scientific evidence.
Well, I do want to, ask you this. We have 40 seconds left, which is unfortunate. I wish we had more time. But, there have been skyrocketing rates of autism in this country. By many accounts, there's more than a 350% increase over the past 20 years. That's explosive. What needs to be investigated to get to the bottom of why autism is now so prevalent?
Look, there are a few things we already know about this, which is that the broadening definition of autism spectrum disorder, better diagnostics, better recognition, and better data collecting have a lot to do with this skyrocketing increase in the number of cases that we're seeing. Yes, we have more to learn. We have so much more to learn about the brain in general, and particularly the way it develops and what can go wrong that leads to autism. There's a number of things that are being looked at in the research. Tylenol is continuing to be studied. All sorts of things in pregnancy are continuing to be studied, and the medical community will let people know when something is discovered that needs to change the way we treat pregnant patients.
Well, Dr. Leah Kroll, it is great to lean on your expertise, especially now. Thank you very much.
Thank you.